Who's sleeping on the floor? Hi! Good morning. Alright, we gotta go get ready soon so Mom can go to the doctor. Hey everybody, I just got to the Wexford Health and Wellness Pavilion. I don't have any kids with me today. They are with my parents, thankfully, who are watching them, while I go to my first ever cardiologist appointment. I'm 31 years old and I have never seen anyone for my heart. And heart disease is the #1 killer for men and women in the United States. And we need to be seeing a doctor annually, just like women, like we do with our pap smears and our mammograms. I've partnered with AHN Women. This is February, which is Heart Health Month. So now is a better time than ever to get in and show you guys what it's like to have an appointment with a cardiologist. You know, we all have these risk factors potentially that are leading to heart disease. If you smoke, if you are overweight, if you have poor nutrition, a sedentary lifestyle, diabetes, high cholesterol, maybe you're a woman who had high blood pressure during pregnancy, or if you're a woman who takes contraceptives, you are especially at risk for heart disease. So come along with me. I'm going to show you just how easy it is and why it's so important that you should be doing this annually. So let's go check it out. As a mom, one of the things I love about the pavilion is Austin's Playroom. This is where you can take your kiddos if you don't have childcare so they can play while you attend your appointment. This is staffed by child life professionals, assistants, and volunteers, and they offer a variety of activities for your little ones. I just had it. It was anxiety, but that was my first one. Bear with me. I'm just going to kind of... Any palpitations? So I just met with the nurse. We kind of went through my family history, updated her on my current medications, a few other personal questions that are very normal for your opening part of the exam. And now I'm filling out the cardiology intake form. And this is what Dr. Ivanova specifically wants lined out before she sees me.
Hi, how are you?
Oh, well, how are you? Dr. Ivanova is reviewing my symptoms, my diet, and history of hormonal imbalances, but she's specifically asking about my pregnancies because I did have elevated blood pressure with my second daughter.
If you lie down.
Next is a physical exam. This is to check my lungs, heart, abdomen, and pulse. Then she starts to dive into reviewing my most recent EKG, which was great, and also my most recent blood work. Now, these numbers weren't all so great. Actually, some of them should be better. Using the numbers from my lipid panel, she calculates my personal risk for developing cardiovascular disease, and she says my risk is mildly elevated, which is surprising to me since I'm in my low 30s. But she stresses that it doesn't matter our age or gender. Anyone in any stage of life can have risk factors and should get screened.
Anything that's in the family concerning, anything that's personally concerning, anything that changes in you feel, in yourself, kind of how you everyday your life goes, and something's not feeling right anymore. So that's the time when you can come and obviously ask for assessment.
Her final reminder to me is that symptoms of a heart attack for women are much different than for a man. Women tend to complain of vague discomfort, shortness of breath, or nausea rather than a sharp pain in the chest. Okay, so I just finished my appointment. It was rather involved with a lot of questions, my personal history, my family history. She is going to follow up with one of the symptoms that I have, which is I get heart palpitations sometimes, somewhat infrequently, but after I work out. And so she does want to further explore that and look at how my heart responds when it's under stress or when my blood pressure goes up or goes down. So they ordered a stress test and an echocardiogram. In the meantime, she suggested that I continue doing what I'm doing in terms of maintaining my weight, start incorporating and following the Mediterranean diet, which she said is great for, especially for women when it comes to heart health. And I do like to drink socially. So she said to swap out the beer for red wine instead. So I am going to start doing that. No complaints there. Two things she said to absolutely not do is to start chewing tobacco or smoking, and I have no plans on doing that. But if you are watching this and you feel like you have any of these risk factors, or you just have the slightest concern or inkling that maybe you need to get checked out, I would encourage you to do so, to have that first appointment and see where things are with your heart, to see if you need to do more testing, or maybe you don't, but it's great to put your mind at ease and to make sure that you have all of those things on file when it comes to your heart and where it is at this stage in your life.